Hello, Miss Laura.
Hi.
How are you?
Good, how are you?
Good. I'm gonna go ahead and wash my hands. Hi, my name is Abdul, and we're gonna be performing a physical assessment today. Okay, I hope that's what you're here for.
Yes.
We'll start by looking at your cognitive function. Do you know where you're at? Can you tell me your full name?
Laura Freebird.
Can you tell me your date of birth?
10/12/87.
And do you know what today is?
The
What day of the
21st of February.
That's great. And how was the weather outside today?
Pretty warm.
Oh, yeah, it's a nice day, isn't it? So the patient is alert, awake, and oriented times 4. She's orienting to self, time, space, and situation. Do you know what we're here for today?
A physical assessment.
Okay, great. And prior to the physical assessment, we were able to perform a family history and a medical history of the patient. We also took vital signs of the patient as well. The physical assessment consists of multiple parts. The first part is the cognitive assessment. The patient appears to be comfortable, appropriate when she talks, and cognitively intact. Next, we will be checking the head for any trauma, for any the size of the head, for any lesions or anything like that. The head appears to be appropriate with the size of the body, which is normocephalic. I'm going to go ahead and palpate or feel for your scalp, okay? And I feel for any lesions or any trauma in your head, okay? Let me know if you feel any tenderness or any pain, okay? Okay. Sorry about your hair. Upon palpating your scalp, your hair is evenly distributed through your scalp, which is a good finding. Also, you don't have any lesions or any abnormalities in your scalp. Next, I'm going to go ahead and palpate your sinuses. Okay, we're looking for 2. This is the frontal sinus, and let me know if you feel any pain. Okay. How's that?
No pain.
And the maxillary sinus?
No pain.
No pain? Great. Since we're inspecting the face, we're looking for symmetry. The eyes seem to be symmetrical. Facial expression seems to be symmetrical. We're going to go ahead and assess for cranial nerve 5 and 7. Can I have you puff your cheek? Just gonna try to press against. Okay. Can you give me a big smile? Can you close your eyes really tight? That's very good. And we are going to go ahead and assess for sensation. Miss Laura, this will be sharp and this will be dull, okay? And we'll be doing this throughout the face, okay? Let me know what you feel.
Dull. Sharp. Sharp. Dull.
Okay, great. Since we're doing the sensation assessment, and that will be cranial 5 and 7 in her face or head, and that was intact, we're gonna go ahead and assess the sensation throughout the whole extremities, okay? So we'll be doing the same thing in your arms and your feet, okay? Let me know what you feel.
Sharp. Sharp. Dull. 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 Dull.
Alright, and her sensation is intact. And since we are checking her extremities, we are also looking at the color of her skin, if she has any lesion, if she has any open wounds, or if she has any trauma to her extremities. Her extremities feel warm, there's no signs of cyanosis, which is a good finding, okay? Next, we're gonna assess your eyes, okay? We'll be assessing cranial nerve 3, 4, and 6, and those are the ocular movements of your eyes, okay? I'm going to have you follow my fingers, okay? Don't move your head, only move your eyes, okay? Alright, I'm just going to get closer to your eyes. Okay, Her cranial nerves appear to be intact, and that will be the ocular movement cranial nerves. Next, we are going to use an ophthalmoscope, and we will be using the ophthalmoscope to shine some light into your eyes, and we're looking at your pupils and your retina, okay? And I'm looking for reaction to the light. Do your eyes accommodate the light or not? And for any pupil constriction or reaction to the light, okay? So I'm gonna look from this side. That's great, and that the pupil is reactive, and that is very good. I'm also going to look at your sclera. It's white and shiny. I'm going to pull down on your eyes, okay? Alright, and that is pink. The conjunctiva is pink and moist. At this time, I'm going to assess your retina, okay? And I'm going to shine some eyes into your eye, okay? There you go, and we are able to see the red reflex, and we're able to track the optical nerve to the macula, and we'll be doing the same thing in the other eye. And the red reflex, and we're able to assess for the macula. And that will conclude our eye assessment. Prior to coming to the room, we will perform the Snellen exam, and the patient had 20/20 vision. Next, we will be assessing your ears. First, I'm going to just palpate or feel your ears, okay? Do you have any pain? Have you had any ear loss as of lately?
No.
Alright, great. Have you had any discharge from your ear?
No.
Perfect. We'll be using an otoscope, okay? This is the tool that we use to look inside the ear. And we're looking at the ear canal and your tympanic membrane, or the drum of your ear. The drum of your ear is supposed to be pearly gray in color, and I'm looking for any obstructions or discharge in your ear canal, okay? Seems like we broke the tool. Alright. I'm gonna pull back and up, and we're able to visualize the tympanic membrane. There is no obstruction in your ear canal. It's pearly gray in color, and we'll be doing the same thing in the other ear. And we're able to visualize the tympanic membrane, which is a good finding. Next, we'll be doing the Weber and Rhine exam. Okay, for the Weber, we'll strike this tuning fork and we'll place it above your head, and let me know if you feel equal vibrations throughout both ears or one more than the other one. What do you feel? And that is good. That is a good Weber exam. We'll be doing the same thing, and that's the Rhine exam. We'll be placing this tuning fork into the mastoid bone, and let me know when you stop hearing vibrations.
No.
Okay, and I'm gonna move away the fork. Let me know when you stop hearing vibrations.
No.
And that is a good exam. I had forgotten to ask our patient here about the 3 words we asked earlier. It seems that I had forgotten the words as well. So, so we'll redo them, and I will do white, black, and table. Okay, I'll ask you in about a minute. Okay, so we did the eye assessment, we did the ear assessment. We're gonna go ahead and move on to the nose. Okay, we'll be using the otoscope again. I'm looking at the nose, the bridge of the nose. It's midline. So as always, we start by inspecting anything we want to assess. It doesn't seem like that she has any discharge. Can I have you plug one nostril and breathe through the other one, and do the same thing for the other nostril? Do you have any difficulties? Do you see any difference?
No.
Can I ask for those 3 words?
White, black, table.
Great. The patient has great short-term memory. All right. Next, I will be looking at each nostril, and we're looking for blockage. The color of the nostrils, and it's pink. You don't seem to have any blockage in there. There's no deformities, and that's a good finding. We already checked for the sinuses at the start of the assessment. Next we'll be checking the mouth, okay? We'll be using our light here and a tongue blade. Can I have you stick your tongue out? And let me see the light. And say ah.
Ah.
Alright, I am also looking at the mouth, the oral, the buccal mucosa. I'm looking at the teeth and gum. The buccal mucosa, teeth and gum are moist and pink. As she said, the uvula and the soft palate went up. And I'm gonna have you stick your tongue out, move it to the left and to the right. And that's an intact cranial nerve 9, 10, and 12. As we said, her teeth are intact, there's no loose teeth. And we're gonna go ahead and move into the lymph nodes, okay? We will be palpating the lymph nodes in a circular motion, okay? Let me know if you feel any pain, if there's any swelling, and that will be an abnormal finding. This is the pre-auricular lymphs, post-auricular, occipital. Do you feel any tenderness?
No.
Right. This is the not post submandibular, submental, and the deep cervical chain, which will lead us. This will be a little deep, so it might be a little uncomfortable. Can I have you shrug your shoulders and we're checking the supraventricular limbs. Normally in a healthy adult you will not feel any lymph nodes, there will be any swelling. The patient will not feel any tenderness. Did you have any tenderness as I was palpating your lymph nodes?
No.
Can I have you lift your shoulders in this fashion? I'm going to check for the lymph nodes, the maxillary lymph nodes. And in the same fashion we'll be doing a circular motion and we're checking for any swelling or any tenderness of the lymph nodes. Have you had any tenderness as I was palpating your maxilla?
No.
And that will be the assessment of the lymph nodes. Next, we're looking at the neck. We are noting the position of the trachea, its midline. We're going to go ahead and assess for the thyroid gland. Usually, in a healthy adult, it's hard to feel. Can I have you swallow? And I wasn't able to feel the thyroid gland. There is no enlargement of the thyroid gland, which means there is no goiter. Next, I'll be checking your carotid pulses. You have one on each side. We'll be checking the left side first. And we're checking for the rhythm and the amplitude of the pulse. The patient has a 2+ pulse. I will be checking the other side as well. And that's what she has bilaterally equal pulses. Can I have you turn your head to this side? Turn your neck, and I'm checking for JVD. There's an enlargement of the JVD, the jugular vein, and that is a good finding. That's good, thank you. Since we're checking the neck, I'm gonna have you shrug your shoulders, and that's good. We checked for cranial nerve 11, doing the neck range of motion. Can you against my hand? The other hand as well. Will you be able to touch your ear to the shoulder? And the same fashion with the other shoulder. And that's great. Did you have any pain doing that at all?
No.
That's good. Next we are going to move to the chest. As always, we start by inspecting the chest. We're looking for equal and unlabored breaths. The patient has equal and unlabored breaths. We'll be going to the side and checking for the size of the chest, and we're checking for the barrel chest. The patient doesn't have a barrel chest, which is a indication of COPD. Okay. Next, we will be going and palpating the chest for any crepitus, and we'll be doing it in a serial motion, so up and side to side, and any crepitus is an indication of air trapped in the subcutaneous tissue in the chest, which is an indication of an air leak in the lungs. The patient, did you have any pain as I was palpating your chest? That is a good finding, and doesn't have any crepitus. I will also check for tactile firmness in the back. Will check in for vibration throughout my arms, as you say the number 99.
99.
On the other side.
99. 99. 99.
and that's great. Since we are already here in the back, we're looking at the spine. The spine is midline. We'll be also doing the CVA tenderness, which I'm going to ask you if you had any infection of the kidneys as of lately.
No.
And it's a way to check for pyelonephritis. Let me know if you have any pain, okay? And that's great. All right, those are all good findings. Next, we will be going to listen to your chest, okay? We'll be auscultating your chest. We're expecting to hear clear breath sounds. Abnormal breath sounds are include wheezing, crackles, rhonchi, or rails, okay? Well, as once again, we'll be doing in a systematic fashion. We'll be going up and downward from side to side. Check the breath through the mouth. Now the left side has 3 lobes. So can you lift your arm and we'll try to listen to all 3 lobes. Alright, we'll check the other side as well. The upper lobe and the mid lobe. That's good. Can I listen to your back? Breath sounds are clear, which is a good finding. We were able to listen to bronchial lung sounds in the upper thorax, bronchiovesicular throughout the middle, and vesicular breath sounds in the lower aspect of the thorax. As I was doing the respiratory assessment, I remember I did the periphery vision exam, so I'm gonna go ahead and do that at this time. And I'm just gonna ask you, at what point do you start seeing my fingers?
No.
Alright, we'll do it over here as well.
No.
Let's do this hand.
No. No.
And the patient has an intact peripheral vision. So we did the respiratory assessment. Next, we will be doing the breast exam. As far as the breast exam for a female, we'll be first inspecting, as we said earlier. We're looking for symmetry of the breasts. And can I ask you to crouch? And we're looking for any dimpling of the skin. We're also looking at the nipples and the way they look, and see if there's any abnormalities there. As far as palpation of the breast, we start at the tail of Spence, and we use a vertical strip method, which is the recommended method of palpating the breast. We go in a circular motion, and if we feel for any lumps in the breast, if we do feel any lumps or masses, we make sure to note the size and whether or not they're stationary or they're not stationary. After the breast exam, we're going to go ahead and do a cardiovascular exam. I'm going to check your heart sounds in 4 points, okay? This is the aortic, pulmonic, tricuspid, and mitral. And since we're listening to the mitral, this is the point of maximum impulse, and we'll assess for the patient pulse. Patient's pulse is regular. I was able to hear S1 and S2, those are normal breath sounds. I didn't hear any abnormalities as far as S3, S4, or murmurs. Since we listen to breath sounds, I'm going to go ahead and listen to the carotid as well, okay? I'm listening for bruise as far as the carotid. Will you be using the bell of the stethoscope? That's great. I wasn't able to hear any breathing. Um, Part of the cardiovascular assessment, we're checking for the circulation to the limbs of the body. So we'll be checking your pulses, your brachial, those are equal and positive, your radial, and that's great. I'll be checking for capillary refill. And that's less than 2 seconds. We're looking at the lower extremities, and once again, look at the skin, look at the hair distribution, looking for cyanosis. We're checking the temperature of the skin as well, and we're checking for the dorsalis pedis. And the patient appears to have good circulation all throughout the body. And that will conclude our cardiovascular assessment. Next, we'll be assessing the abdomen. I'm gonna ask you, have you had any troubles with your tummy lately? Have you had any indigestion, nausea, vomiting?
No.
Great. Can I have you lay down? Thank you. Make sure that the patient is comfortable. We'll start by inspecting the abdomen, so we'll start from this side at an eye level, and we're looking for the shape of the abdomen from here. The abdomen appears to be flat. We might see some pulsation of the aorta. That is a normal finding. There is no bulging of the abdomen. We'll come to the feet of the patient and we're looking for symmetry in the abdomen. The abdomen appears to be symmetrical and equal. At this point, we're going to go ahead and auscultate the abdomen. We will divide the abdomen into 4 quadrants, and we'll start in a circular motion. Okay. Patient has active vowel sounds in our quadrant. Since we're auscultating, we're gonna go ahead and auscultate the abdominal aortic artery and listen for any bruits, and the renal arteries as well. Wasn't able to hear any bruits, which is a normal finding. Next we precast the spleen and the liver. The spleen is at the edge or at the 10th intercostal border, and we are expected to hear some tympany. And also, as we're doing this, we are assessing for any enlargement of the spleen and the liver as well. Liver, we expect to hear some dullness around the borders, and also we assess for any enlargement of the liver. Right, and we weren't able to find any abnormal. Everything looks normal. We're going to go ahead and palpate the abdomen. Let me know if you feel any pain, okay, or tenderness as I palpate. This will be deep palpation, and do you feel any tenderness?
No.
Feel okay? Okay. We're gonna go ahead and help our patient up. And that will conclude our abdominal exam. Next, we will be doing a genitalial exam. And for females, we will be assessing the outside of the genitals. We're looking at the labia minora and majora. And we're looking for any trauma, any swelling, any redness. We're also assessing for if there's any foul odor coming, and or any trauma to the genitals. We'll be palpating the ovaries and ask the patient if they have any pain. For male, we're assessing for any discharge, any redness. We're assessing around the testicles for any lumps or any masses, and for the testicular reflex, where we feel around the thigh of the patient and know that the testicles will go up. And that will be the genitalial exam. Next, we'll be doing a musculoskeletal exam. First, we'll be assessing the sensation of the patient. We did that already. We already did that. That's great. So we'll be doing range of motion and musculoskeletal. Can I have you squeeze my two fingers as hard as you can? Patient appears to have equal strength bilaterally. Can you push against my arms? All right. And towards you. That's great. Can I have you? I'm going to check for the range of motion. Can I have you do your hands like this and bring them up all the way up and down? Have you had any trouble doing that? Patient appears to have good range of motion in her upper extremities. Can I have you stand up? As the patient is standing up, we're checking for the spine. Spine is midline. Can I have you reach your feet with your hands? Patient has good cervical curvature. Shoulders are symmetrical bilaterally. And do you have any pain as you're doing that? And that is a good finding. Next, I'm going to have you take a few steps, and we are checking for your gait. And the other way, patient appears to have a good gait, and there is a good finding. I'm going to check for your coordinations. If you can just close your eyes and find your nose. And with the other hand. And patient has good coordination as well. That will conclude our physical assessment. Everything looks great. Hope to see you soon again.
Thank you.
Thank you, Ms. Lara.